I was part of Way Station since I was 28 years old, and now I'm 42. Kept me safe and it kept me out of trouble. I'm in the dual diagnosis program, and that treats substance abuse and mental illness as well. And it's for people that are having a little difficulty on their own in society, and they need a little extra help and a little extra support.
I think the one thing that Way Station really tries to stand for is that we are a community. You know, we call our clients members because they're members of this club, they're members of this program, they're members of this organization.
People's overall wellness, not just their psychiatric wellness, has been a pillar in the organization at Way Station.
All right, well, we will start the morning meeting now. Would someone like to read the announcements today?
The individuals that we're entrusted to care for died 25 years earlier from lung cancer and other somatic illnesses that were either caused by tobacco use or intensified because of their tobacco use. How do you go about telling a population of people that smoke a lot that they're not going to be able to do that anymore when they come here? We learned about the community of practice through the National Council and definitely saw that as an opportunity for us to engage with other providers across the nation to learn what has worked for them, what has not worked. There was a group of us that were on regular phone calls and sharing our experiences and our fears and our concerns about how to make it happen. We were very concerned about how the clients that we serve were going to react to tobacco-free campus. On one of the very first calls with community practice, right out of the chute, someone said, "We know that you're scared that nobody's going to come to your program anymore and you're not going to be able to meet clients' needs and you're not going to be able to capture billing and oh my golly, everything is going to fall apart." So at that very initial call, hearing that from somebody who had been through the process and assuring us that it was going to be okay was very helpful. We didn't have any pointed early initiatives as an organization for tobacco-free campuses, but we've always been talking about it and trying initiatives individually. It took us those first 4 to 6 months meeting with senior leadership teams and staff to get the organizational buy-in before we took it to the individuals that we served. Our CEO shared the vision of becoming a tobacco-free organization and invited people to share concerns.
It's really hard. You know, you gotta have it, you've been smoking, it's hard. Yeah. And you know, I stopped for 5 days. When I get done eating, I gotta have that cigarette.
Hearing what people's concerns were, not just saying, we're gonna do this, it doesn't matter what you say, but we are gonna do it, but we wanna hear what your concerns are. We wanna be able to work through that. I think that's how we got the buy-in, by letting people be real about their feelings and concerns.
You know, it was about 50-50. There was 50% who were sort of, this is great, this is, yes, we definitely need to do this. You know, either I myself am sick of walking through the cloud of smoke to get to the vans every afternoon, or, you know, I myself smoke, but I recognize that it's not the healthiest thing to be putting others in the way of that. But then there was, you know, that other half of folks who said, this is what we do. And that was anxiety producing for them, and they weren't sure how they were going to handle that. And there was a lot of questions about how, what is it going to look like? What is it going to look like?
There's a lot of members who are really happy that we've gone tobacco-free now. We're a tobacco-free campus, because it used to be when you walked out the back door, you're walking through a cloud of cigarette smoke.
Way Station has its own personality and our own kind of way of being and working with the people that we serve, and we didn't really want a cookie cutter model that was dropped on us and you have to do it exactly this way. We participate in a lot of evidence-based practices that are very prescribed and they work great, but we just didn't feel like that was the way to go with this initiative, that we needed to garnish all the information that we could from people that had been through it, and then figure out how does that work for us at Way Station? How do we give people some ability to be individualized in their operational efforts?
I'm happy with how it turned out and the process that we took. If an organization is doing this, each one has to kind of take it in their own way.
We had to just keep reminding ourselves that the purpose and the why was because we want our folks to be well.